Skin in its natural state is always under functional tension. Its viscoelastic properties allow it to react dynamically to movement and pressure. Microscopically, skin is a dynamic system including keratinocytes, fibroblasts, structural components including collagen and elastin, and blood vessels. When skin is cut, functional tension is reduced, and cellular structures inherently take on a stable configuration. The normal healing process of skin leads to rapid proliferation of granulation tissue, which locks the wound edges and prevents further movement. The addition of negative pressure wound therapy enhances the formation of granulated tissue and develops a senescent or chronic wound. Once the wound edges are granulated and fixed, they become very resistant to reapproximation. However, skin can be returned to its original state when dynamic appositional forces are maintained in the early stages of healing. Cellular structures return to their normal tension configuration, and granulation is reduced. This prevents the skin edges from becoming fixed and promotes fast healing. When additional tension is introduced, further biomechanical processes come into play. Mechanical stretch causes the tissues to elongate. Skin cells and collagen fibers straighten and align. Elastin fibers microfragment. Once the skin reaches the limits of mechanical stretch, biological creep takes over. In this natural physiological process, fibroblast numbers increase and become activated, synthesizing new collagen. Vascularity is increased and new skin cells are created. Mechanical stretch and biological creep act together to expand skin to almost limitless proportions. This mechanism of tissue generation occurs naturally every day. In the abdominal wall, the anterolateral muscles exert lateralizing forces across the midline. Muscle fibers cycle constantly between the contraction phase, in which myofibrils actively shorten, and the relaxation phase, when the abdominal wall's natural tension pulls the fibers back to their initial length. If this tension is lost, the resulting imbalance causes the muscle to become fixed in a contracted state that is resistant to appositional traction. In abdominal surgery, the continuity of the muscle wall is disrupted. The forces exerted by the anterolateral abdominal muscles cause the wound to retract into a stable state that becomes increasingly difficult to reapproximate. The key to closing an abdominal wound is to restore the normal elastic tension of skin and muscle with dynamic appositional forces that are applied as early as possible. This produces a return to natural physiology, which enhances the effect of the therapeutic forces and facilitates gradual closure. The technology behind Southmedic's Dynamic Tissue Systems line of products has revolutionized trauma and surgical interventions for dramatically better patient outcomes.